Good afternoon, everyone. The title of my big PhD topic is Clinical Pathophysiology of Polycystic Ovarian Syndrome. My name is Rita Vajna. I'm working on the Barrow Street Department of Obstetrics and Gynecology. My supervisors are Szabolcs Várbíró, Levente Sára, and Judith Hetesi, and my scientific methodology supervisor is Fanny Meznaric, and the project statistician is Szilvi Kisdala. My mission is to find the best therapy option for higher ovulation rate, endometrial thickness, and pregnancy rate in women with PCOS. My vision is more women with PCOS can have a child. There are my specific goals. The title of my first topic is comparing the efficacy of letrozole to clomiphene citrate on fertility in women with PCOS. First, I would like to speak a little bit about the background. The incidence rate of this disease between 3 to 10%. The PCOS is the #1 cause of infertility. The most problem with this, the high testosterone level, the irregular periods, and infertility. We have two good pairs options for follicular stimulation. The first one is clomiphene citrate. This is an estrogen antagonist. We use that since 1967. But this drug has many side effects. The most important side effect is anti-estrogen effect. This is endometrium thinning. We have an alternative options. The name of this drug is Letrozole. This is an aromatase inhibitor, and according to the literature, Letrozole did not show anti-estrogen effect, and patients tolerated it better, and the pregnancy rate is higher than if a patient used clomiphene citrate for ovulation induction. Our aim is to compare the effect of letrozole and clomiphene citrate on ovulation rate, endometrial thickness, and pregnancy rate in PCOS patients. My clinical question is letrozole superior to clomiphene citrate in treatment of infertility in PCOS patients? This was my PICO, and my hypothesis is letrozole therapy is superior to clomiphene citrate therapy in the improvement of ovulation rate, endometrial thickness, and pregnancy rate. I made a systematic search. This was my search key, and this is my flowchart of selection. And finally, I found 15 eligible full text. Now I would like to speak about the results. The first outcome is ovulation rate. This is important for us because when a woman hasn't ovulation, in this case, this patient will not be pregnant. We can see on the forest plot that when a patient uses letrozole for ovulation induction, in this case, the odds for the patient is higher for the ovulation than if a woman uses clomiphene citrate for ovulation induction. The second outcome is endometrial thickness. This is important for us because when the endometrium is thicker, in this case, the embryo implantation will be better. We can see that when a patient uses letrozole for ovulation induction, in this case, the endometrium will be thicker than if a patient uses clomiphene citrate. The previous result and this result is statistically significant and clinically relevant. The third result is pregnancy rate. This is important for us because we would like that more women with PCOS can have a child. We can see that when a patient uses letrozole for ovulation induction, the odds for the pregnancy is higher than a patient uses clomiphene citrate. This result is statistically significant and clinically relevant. My fourth outcome is a very new outcome in the literature, the resistance index and pulsatility index of subendometrial arteries. This is important for us because when the resistance index and pulsatility index is lower, in this case, the circulation in the uterus cavity will be better, and the embryo implantation and embryo development will be better too. We can see that when a patient uses letrozole for ovulation induction, the resistance index and pulsatility index will be lower than a patient uses clomiphene citrate. The result is statistically significant for the resistance index, not statistically significant for the pulsatility index, but in any cases we see that is a clinically relevant result. My strength was I used only RCTs, and this meta-analysis will be the first meta-analysis to comprehensively assess for resistance index and pulsatility index of subendometrial arteries. The most important limitation was that we hadn't enough data about live birth rate. The conclusion is thicker endometrium, higher ovulation and pregnancy rate, and better subendometrial circulation in letrozole group compared to clomiphene citrate group. Implication for practice, urging the implementation of letrozole for ovulation induction in clinical practice, and the implication for research. More studies are necessary reporting subendometrial circulation data. This is my manuscript status, and now I would like to speak about my second project. The title of my second project is Investigating the Efficacy of Herbal Remedies on Metabolism and on Endocrine Status in Women with PCOS. The background is very similar to my first project. The PCOS affects 1 in every 10 women worldwide, which finally causes infertility and diabetes mellitus. The first-line treatment is metformin. We use that since 1994, but this drug has many side effects, and we have herbal remedies. There are alternative options, but we know that the herbal remedies cannot replace the metformin, but they can enhance this positive metabolic and endocrine effect of metformin, and it leads to less metformin might sufficient. Or aim to compare the effect of herbal remedies and certain metformin or placebo regarding metabolic and endocrine status in PCOS patients. My clinical question was, can herbal remedies improve the metabolic and endocrine status of PCOS patients? This was my PICO. And my clinical implication is herbal remedies as an effective therapy to improve the metabolic and endocrine status in PCOS patients. I made a preliminary search, and this was my search key, and thank you for your attention. And my sentence is, what you can't explain simply, you don't quite understand. Thank you very much.
Thank you for the presentation. I want to ask you, in your first project, what can be the reason why the heterogeneity of the endometrial thickness was so high in the previous studies?
Thank you very much for the question. I think that earlier the image resolution of ultrasound was worse at nowadays, and this is the reason, I think. Thank you.
Thank you.
Thank you for this very thorough presentation. I was just wondering which herbal remedy has the best improvement on the metabolism status, metabolic status.
Thank you for the question. The most commonly used 19 types, and the cinnamon is a first good option for the enhance the positive metabolic and endocrine effect of metformin. Thank you very much.
Thank you very much for the opportunity to ask a question. I was just wondering, do you have any data on how often is letrozole used in the clinical practice in comparison with the clomiphene citrate?
Thank you for the question. It is not yet used in the clinical practice because we have not enough experience for this drug yet. Thank you very much.
And what other options do you know for ovulation induction? You just mentioned two, the letrozole and the clomiphene citrate. What other options?
We commonly used the clomiphene citrate. This is the for ovulation induction. This is the
Can you use
basis.
FSH as well?
This is about yes too, but with by the PCOS patient, this is the basis therapy, the clomiphene citrate.
And in that case, if it is not working, what do you do? Because sometimes it is not working. I'm sure about that.
Yes, I know. We give for the patient higher dose from clomiphene citrate. Yes.
Just clomiphene citrate?
Yes.
In that case, you can give FSH, I'm sure. Okay.
Yes. Thank you very much.
Thank you for your presentation. I just would like to notice that, or ask, do you know that metformin is actually also extracted from a herb? But this makes your research even more interesting, actually. It's extracted from Galliga officinalis. So it's a herbal substance, actually.
Yes.
Only it's extracted. Just, thank you. I just wanted to...
Okay, thank you very much.